what we are doing and why. So first thing, there's no such a thing as dental disease, okay? As far as I'm aware, I've Googled that, I couldn't find anything, okay? And this is going to be something I'll cover also in the last lecture. There is no dental disease. You are not doing dental. You may have periodontal disease, most common. You may have fractured teeth. You may have non-vital teeth. You may have hypercalcification of teeth, enamel defects. You may have tooth resorption. You may have oral mass. There may be stomatitis, so periodontal diseases. This is medicine, this is not dentistry. Malocclusions. You're expecting to find 42 teeth in dog's mouth and 30 teeth in cat's mouth. Something may be missing. And if you find one disease, it doesn't mean that magically it prevents this dog or cat from having another in the same mouth or even in the same tooth. Okay? So before you decide I need to extract, find out what is going on and decide if I'm extracting and why. And also, the type of disease, stage, etc. will massively affect your surgical planning because two teeth are not the same. I know that our CVS says that extraction is a first day skill, and I would agree to that in most cases of periodontal disease, but if you got advanced tooth resorption in a dog, this is probably the most difficult oral surgery case I can think of. So first of all, if you identify the problem, think about extracting or not. Does the tooth first of all require any treatment? Because you may assess the mouth, find pathology, and decide that this is not clinically relevant, even though this is not normal. If you look in here, on the corner, you got abrasion. You check things with the Sharp Explorer radiographically. There's tertiary dentin deposition. The tooth is endodontically healthy on radiographs. Do you need to do anything with that at the moment? No. You need to know what you're looking at, what are the consequences, fully diagnose that, and decide your plan. And sometimes the plan will not be to extract or to do anything with it. The plan will be to tell the owners what to avoid, not to cause further damage to that tooth. And that's it. And you did the service to the dog and the owner. That's what you're being paid for. Not for scaling, polishing teeth. Think, if you decide, okay, the treatment is required, think of if extraction is the only option, what are the other options? And then you may discuss with the owner what they want to do with it. Is the problem that you're finding localized or generalized? It may also affect your surgical planning for that particular tooth and mouth and the patient in general. How many teeth are affected and where they are? Am I just simply extracting one or two incisors, or do I have incisors, molar, canine, and something else in the other arcade? Again, your approach to the case will be different. Look at the general health status of the patient, because again, that may affect how long anesthesia do you want to do. In certain cases, you might decide that something that otherwise you would treat may not necessarily be required now. If you got problem that is there, but it's clinically quiet, and for example, you got 16-year-old dog with otherwise somewhere else a malignant tumor that has got, say, 3 years to live, you will not be concerned about retained tooth with no current pathology around it. It will be different if this is a 2-year-old dog that's otherwise healthy, and this tooth will be sitting there for several years. So always diagnose things fully, look at the patient, and then decide where you are. Last but not least, you need to look at owner's expectations, maybe not in the terms of what you advise, but when you discuss the options. Some owners may decide that I want that for my dog, not the other. What you need to do, you need to give a full and proper advice. So before you make any plan, look at every single tooth separately.